everybody. Here is Milena and Melissa from Madison in Wisconsin, and we are presenting a Capital Region Health Community project that we got financed from the Plan4Health grant. Here's the brief outline. We are talking about a brief introduction of our project, and specifically we're going to focus on the lesson learned, focusing on the institution coordination that we think is a key for the new cohort to understand the complexity of. And it's breaking down in two phases, the phase of collecting data and the phase to apply into the community, particularly focus on the urbanicity aspect of the community we selected. Here's again Milena and Melissa. I'm Milena Bernardinello. I'm the Healthy Community Planner for the City of Madison.
And Melissa Deach from Capital Area Regional Planning Commission.
Our coalition was a combination of institutions, and we coordinated together with the UW Family Medicine, the City of Madison Planning Department, Capital Region called CARPSI, Capital Area Regional Planning Commission, and a couple of other coalitions related to child with obesity. They also have connection in the community. The description of the project is very basic in this phase. We had a tool called Active Living Index. It's a web interface interactive tool we created to present objective data of the county. County is our geography in which we work with, and we also are going to present the selection process in which we adopted to select the three community we decided to do the implementation of this project on. Briefly, the lesson learned I was referring to is creating the institution coordination. The phase one was creating the data. The data required an institution coordination between the planning department, CARPSI, and strictly the Family of Medicine, which were giving us health data. And so we were able to combine planning data and health data to create this index. We are not going to go too much in the index because we want to focus mainly on the activity happening on the ground. Related to that aspect, the urbanicity was a key to select the community and also to start to do the implementation part. The main theme that emerged during this second phase was the time frame. And we are going to talk more specifically of the three communities we selected, what this time frame referring to. But the most important component was to understanding how the institution work in different urbanicity settings, how to have a real good communication and a communication channel, and also how to implement it in the field. So we're going to look at now at the lesson learned at the three urbanicity level, in which we decided to work on when we select the community. And I'm leaving the conversation to Melissa.
The three communities we worked in began with rural. The primary goal for the rural communities was to support community sidewalks and complete street policies. We chose the village across Plains, which has a smaller planning department and which is a bit more hands-off. So they generally don't really have community engagement, so this was a real important piece for them. So we were here to assist in the public engagement and capacity building for the community in terms of trust and trying to get people who could actually relate to the community as insiders to promote and educate the community on various topics in terms of healthy living and active living. So in accomplishing this, we really had to find a community organization that was well trusted in the community, because the lack of trust from outsiders can really affect your implementation plan. So we used this organization as the lead for our initiatives and served more as the background advisory team as well as technicians. With this setup, we were able to help the community understand the wants and needs and helping the actual individuals in the community have a voice in the things that will affect them most. The second community we chose was a suburban community. We decided to work in the city of Fitchburg, which is a community directly outside of Madison. The primary task for this community is to assist in engagement process for bike and pedestrian planning. The community has a small planning department that is very active and functions a system of checks and balances, which became important in understanding how we will implement our strategy. The communication structure was clear in terms of the chain of command, as things we're constantly going up the chain and coming back down for every detail that we were getting ready to implement. A key factor in this is keeping the momentum going in terms of communication flow. The faster things move up the ladder, the faster things come back down, the faster we can implement. So to get those communication channels running smoothly was key in actually achieving some goals. Since this is a larger area, it is also key to remember that the dynamics are different in the community, and various communities have different ideas of what they may want. So it's important to try to figure out a way to connect with each of them. Since the communication structure is already solid in place, it becomes simple to engage smaller communities with the larger communities in terms of the planning team and actually becoming effective. The last community we work in is the community of Park Edge Park Ridge, which is a small neighborhood in the city of Madison. This neighborhood faces various issues such as walkability and equitable access. There's a lot of tension within the community that must be addressed due to these elements being present. So a huge goal on this project was to gather input from various voices that will lead to a constructive dialogue for upcoming projects, including a road construction project and neighborhood employment center. Since Madison is a larger city and has multiple entities within decision-making that are playing a role in implementation, it was really key in actually getting some of these entities to sit down at a table together and actually discuss the projects they have going on and how they may overlap and becoming more efficient in planning and implementation. Similar to Fitchburg, you have to understand the various checks and balances within the departments in terms of communication and making sure that communication and action is being held within appropriate boundaries. So once these networks were established, it actually made it easier to understand these boundaries and be able to connect all the dots and have a smooth and consistent communication plan that becomes more effective and less likely to break down in the long run. And what we have learned from this is that if you do have a breakdown, the miscommunication can slow things down drastically. And we were able to learn various ways to actually make up for some of these slowdowns by improving and bringing different people in to the table to actually connect some of these dots. So once we were able to get the communication flow running and properly established, we were able to create a plan and move on to our execution phase that will move quicker with the community and serve multiple purposes.
So that's it, what we have to share with you. I hope we like this lesson and will be helpful for your new project. Feel free to call us. You find our information down here. Here's Milena. Thank you for listening to us.
And here's Melissa. And once again, we thank you for listening.